This is a case of recurrent seborrheic keratosis perineum managed with bilateral gracilis advancement flap. Seborrheic keratosis of the perineum is a rare and difficult disease to treat. This is a case of recurrent seborrheic keratosis perineal region managed with bilateral gracilis advancement flap. 52-year-old female with no comorbidities presented with irregular hyperpigmented swelling over the perineum and the vulva. She had a history of excision of similar lesion over the area 2 years back. She underwent wide local excision of the swelling and bilateral gracilis advancement flap. VY advancement flap was planned initially following excision. Since the defect was large, gracilis muscle was incorporated into the VY advancement flap to ensure good vascular. A small bilateral faciocutaneous rotation flap was also done to cover the defect over the perianal region. Wound closed with suction drain in situ and drain removal was done on post-op day 5. This is the image showing the flap plant and the gracilis muscle. These are the images taken during intra-op. This is the post-op image. Patient was discharged on post-op day 7 and on follow-up after 2 weeks the wounds were healed well and the staplers were removed. On follow-up after 3 months there was no fresh complaints and no signs of recurrence were noted. Seborrheic keratosis is a common benign epidermal proliferative lesion. Seborrheic keratosis of the perineum or perigenital region is uncommon and large lesions need excision and reconstruction. Incorporation of muscle into the advancement flap helps in case of larger defects. Incorporating gracilis into the VY advancement flap improves the blood supply to the flap. Bilateral gracilis advancement flap is a very reliable flap for large defects of the perineum. Thank you.